Advice on giving spinal block. Giving anesthesia. When undergoing surgery, some patients require anesthesia from the anesthesiology team to facilitate surgical treatment. There are several ways to give anesthesia depending on type of surgery, underlying disease, patient's choice. 9 steps to prepare yourself before receiving anesthesia. 1. Abstain from all kinds of food and drink for 6 to 8 hours. 2. Report your history of congenital disease and use of regular medications, such as antiplatelet drugs, diabetes medications, blood pressure medications, and others, as well as vitamins, dietary supplements, and herbal medicines to your doctors. 3. Report allergies to medicine, food, or all kinds of substances, and also your previous surgeries and other health problems. 4. Refrain from smoking at least 2 weeks before surgery to reduce flame and cough. 5. Remove nail polish and have fingernails cut short to enable measurement of oxygen at fingertips and observe changes due to lack of oxygen. 6. In case of receiving current types of surgery, which does not require an overnight stay in the hospital, you must have relatives who can assist in contacting the staff, act as a caregiver on the way home, and take care of you for at least 24 hours. 7. If you are pregnant or suspect that you are pregnant, you must inform the anesthesiology team because some medicines can pass through the placenta and may cause detrimental effects on the baby. If surgeries are urgent, it should be done after giving birth. 8. Remove removable dentures, contact lens, and all kinds of jewelry. If you have loose teeth, the anesthetist should be informed. 9. In case of illness related to the respiratory system, such as fever, cough, sore throat, sputum, or runny nose, the anesthesiologist must be informed in detail. Patients must recover for at least 2 weeks before anesthesia can be administered with minimal risk. Giving local anesthesia, spinal block. The patient will feel numbness from the middle of the body down to both legs. Surgery can then be performed without pain, but the patient doesn't have to be unconscious. Advantage: suitable for surgery from the navel level down to both legs. Risks: nerve injury, stop breathing, convulsions, extended period of numbness, headache, temporary difficulty urinating. In very few cases, patients may face more serious complications that can be dangerous and death. When it's time to give anesthesia in the operating room, vital signs examination procedure, measure blood pressure, perform an electrocardiogram, check the oxygen concentration in the blood. Local anesthesia for spinal block. Spinal block pose type 1. The patient lies on his side with his back facing the edge of the bed. Both knees and head are bent forward to make the back arch as much as possible. Spinal block pose type 2. The patient sits on the bed, hugs a pillow, and bends his neck and shoulders forward to make his back arch as much as possible. If the posture is good and the patient is able to curve his back well, the anesthesia injection will be much easier. The patient will only feel a slight pain. After the block is finished, the patient will lie down supported by one pillow. The doctor will measure pressure more frequently because the patient's blood pressure will decrease, and ask about the level of numbness until the feeling of numbness increases from the middle of the body down to both legs. The patient may also experience nausea and vomiting in the early stages of the spinal block. When fully numb, some patients may feel uncomfortable and have shortness of breath. However, they will not feel pain during surgery. Patients will remain numb and unable to move their legs for about 2 to 4 hours after surgery. However, the wound will not immediately hurt, unlike with general anesthesia. Guidelines for behavior after receiving anesthesia. Early post-operative ambulation. In case of spinal block and anesthetic injection, you should lie down supported by one pillow for 8 hours. You should change your sleeping position regularly. Turn your body on your side at least every 2 hours, and sit up and exercise as soon as you feel better. In case of experiencing pain at your point of surgery, notify the nurse for painkillers. The surgical incision site may have a rubber tube coming out from the wound or outside of the wound for drainage. Do not allow patient to remove these items. Be careful not to cause pulling, sliding, or slipping. You should look out for possible complications such as headache, difficulty urinating, and other unusual symptoms, and tell your doctor if you experience any. If your doctor allows you to eat, you should eat a little at first, then observe whether there are symptoms of abdominal discomfort or not. The next day, you can start eating normally, especially when returning to recuperate at home. You need to nourish your body because food makes you healthy and wounds will heal faster. Take all medications according to your doctor's treatment plan. If there are abnormal symptoms, you can call to inquire or come back to see doctor before your appointment date. Once you have received complete information and you are ready, please sign your consent. In the letter of the consent, for the use of anesthesia, complete before receiving the anesthesia service. We love you. May you all be safe, good health. Anesthesiology team, St. Mary's Hospital. Thank you.